I hear that a lot in my myofunctional therapy patients that, you know, their kids are in the room 8 to 10 hours. They don't understand why, you know, we have some other things going on. But I think one important note is that as a parent, you're not in there with your children checking on how they're sleeping.
Our tongue is supposed to act as like a scaffolding for the development of our jaws. And so when our tongue naturally rests on our upper palate where it should be,
it's all just part of when the body gets placed in that, you say fight or flight, sympathetic, versus the rest. Our body has a cascade of different things that go on, and bedwetting can be one of them. I'm Dr. Chelsea Todd. I'm here back with my best friends, Chelsea Hansen, myofunctional therapist, and Blair, nurse practitioner, and we're doing another episode of Mouth Breathers. So today we want to focus and talk on our most common things that we hear in a new patient exam. What are our big complaints? What are the most common things that Blair is seeing, because she is doing a really comprehensive medical workup. So Blair, when you have a new patient that comes in, child, adult, what are some of the common things that you see reported back to you?
I would say the three top complaints I get are that I'm snoring, or I've been told I have a narrow palate, or I've been told I have a tongue tie. And then also, let me add on there, I mouth breathe. And some of these people are coming to me because they've been referred, and then they come to me and they're like, I've been told I have a narrow palate, so here I am. And it's funny because most of the patients that I see, if I ask them in that visit, do you have poor quality of sleep? Most of them say no. And the reasoning behind asking them that is because oftentimes with narrow palates, with tongue ties, with mouth breathing, it all stems from an airway issue. And we get concerned with airway issues and sleep because if we have something that's obstructing our airway at night, that's causing like what I think most people know as obstructive sleep apnea. Okay? So a narrow palate, a tongue tie, those can be signs of an issue with tongue space or an issue with tongue range of motion. And so what that can lead to is poor tongue positioning during sleep, tongue falling back, obstructing the airway, that kind of thing. So what I find really interesting is that patients come to me and they think that they don't have any sleep issues at all. But then by the time I finish with their visit and I kind of go over some of their symptoms, some of their signs, I'm like, there's no way you don't have a sleep issue. You've definitely got a sleep issue. And they're kind of surprised and they're like, wow, like I had no idea. Like I feel like I slept fine. And their body's probably getting kind of alerted at night throughout the night because of the airway issues that they've got going on, but they just don't realize it. And maybe they don't wake up fully. They're not completely alert. But hands down, I feel like their body is getting these signals throughout the night and they're just not aware of it.
Yes. And I think that with our culture too, right? We work. We don't talk about sleep. So we normalize poor quality of sleep. We normalize having 5 cups of coffee a day. Oh, like I'm proud of myself. I run on 5 hours of sleep. And, it's kind of our cultural thing too. Like snoring is normalized versus looked at like, oh, that's a red flag. That should be something we should be addressing. With all my dental school background, we didn't talk about sleep. These were not things that we went into. All of your medical training, did you get much, information and discussion over sleep or snoring? Like we should worry about these things?
No, I did not. Not at all. I mean, I think the gist of my training in nurse practitioner school was this is a CPAP. It's used for obstructive sleep apnea. And that's about it. And
right.
That's a lot of patients coming to us. Like that's the number one thing they want to avoid. They're like, I do not want a CPAP.
Yes. And that's kind of the blanket treatment in Airway for everyone. And that's the part of the problem, is that we're finding these people when they're in a place where they have severe sleep apnea, they need a CPAP versus, finding and noticing those warning signs way, way back when they started. Is maybe even a child and infant. And this has just been growing and developing for a long time. So I think we need to, as a society, talk about how much sleep we need and prioritize quality, and how much sleep we're getting every night versus just running ourselves ragged all the time. Because, you do those sleep studies on people and they're very much surprised the results sometimes that they get back.
I've had people in tears when they get their sleep report back because they're just so alarmed. And they're just so surprised that not even do they have like an issue, even if it's just mild obstructive sleep apnea, but for some people it's severe obstructive sleep apnea and they didn't even realize they had a sleep issue.
Yeah, because they're coming in because they have maybe a hormone imbalance or so other things that we typically are finding that lead us to, no, you have a sleeping problem. They're being referred for those other things that we know putting it all together leads to a big airway issue. How about you, Chelsea, from a myofunctional therapist standpoint for sleep?
Well, I just find it interesting that the tongue is never talked about by anybody, pediatricians, even dentists, really. I mean, most dentists don't talk about the tongue. And the positioning of the tongue has to do with almost everything when it comes to good quality of sleep. And once again, people have no idea why we even bring up the tongue, why we look at scalloping on the tongue, why we talk about tongue placement, why we worry about, the size or lack thereof of the tongue. And really the space, like Dr. Blair was talking about, people think that, I have a narrow palate and that's what my dentist told me. I really don't know why that matters or how this plays into it. But if you have a narrow palate, the tongue only has one place to go, and that's down and back every time. And so it's very important to make sure we address the tongue.
And let's talk about that a little more. So with a narrow palate, and again, I'm coming from dental background, I would look at that, but I would think more about this is how the teeth are going to come in because we have a narrow palate. It never crossed my mind with all my training and all the continuing education I ever received. I never thought, the tongue is going to have a hard time seating up there because it's too narrow. That never crossed my mind. And I've seen so many kids in my career, and now I see them differently, right? So you and I have seen how many people that their tongue it's overflowing. What we mean by narrow palate is your tongue should sit in your palate, and when there's not enough space and your teeth are too narrow, it's gonna fall over the edges. It can't suction, and when you're asleep, it can fall back into the airway.
And the thing I don't think we've quite touched upon yet is the natural resting position of the tongue has a lot to do with how wide your palate is. Our tongue is supposed to act as like a scaffolding for the development of our jaws. And so when our tongue naturally rests on our upper palate where it should be, our jaws can develop nice and wide around the tongue to encompass the tongue. So if our tongue naturally rests in a lower position on our lower palate, lower mouth, we don't get that same jaw development. So then we see these jaws that become narrow and kind of high and vaulted. And if you think of, I'm a short person, so analogy, if you think of me trying to touch this tall ceiling above me, it's going to be extremely hard, okay? So not only are we dealing with a width issue, but also like a height issue, if that makes sense.
Yes, because we're too narrow and it's too vaulted like this.
Yeah.
And other things that contribute to that are just our environmental, and as a society, what we're doing. Our foods are soft. We have pouches now. I think of all the things that we've replaced: hard vegetables, fruits, meats, all these things we've replaced with soft, easy to go foods. Crackers, all of that compression on the jaws builds our whole midface. So we have a lot of changes going on. Even allergies, people are susceptible to lots of different things now. You can't breathe through your nose. your mouth breathing. So all of that can change our jaw structure
Yes,
as well.
because we have to remember that the roof of our mouth is the floor of our sinuses. So if our palate, or, the roof of our mouth is more high and narrow, that means that the floor of our sinuses is also going to be more high and narrow. So we're going to have narrower sinuses. We're going to be more at risk for that chronic congestion inside our sinuses there.
Yeah, it's a real domino effect when one thing kind of goes wrong. We're not saying it's always just the tongue tie, just the narrow palate. It's usually a combination of multiple things. So,
well, and you need your tongue to masticate properly, chew properly. In order to chew and move food, the tongue has to be mobile. And that's also a component that, people don't worry about. I'm functioning fine. My tongue ties, I've had it my whole life. I don't need to do anything with it. But if you can't chew food properly and move food right to left, therefore you can't masticate, jaw developments could be underdeveloped, tongue's going to sit low. And this is a very interesting fun fact. It only takes 1.5 grams of pressure to move a tooth. And the tongue gives off about 5 grams of pressure. And you swallow about 600 to 1,000 times a day. And when I share that with patients, they're like, wow, so the tongue's really important in my mouth. So if you think about development of the midface as a whole, the tongue is probably the most important component.
Yeah. That's why I've had patients who've been in braces multiple times, and they come to me and they're like, I don't know why my teeth keep falling out of alignment, why I have to keep getting braces. Well, it's because you have low resting tongue posture, poor tongue posture, you have a tongue thrust, your tongue keeps pressing in the wrong spot. And usually that's a tongue space issue, a tongue strength issue, or a tongue tie issue, or all three.
All three. And then we end up with poor quality of sleep.
Yeah.
Every time.
And we don't even, and that's what's interesting, right? All these people, you have a tongue tie throughout, but they don't even know you sleep every single night. And most are like, I do have poor sleep. You take a sleep study and then you actually show how many sleep disturbances you have, what snoring you have. That's very eye-opening for lots of patients. So I want to give you guys a couple numbers that Dr. Zaghi posted, and you guys can decide at home how many people actually get this type of sleep. So preschoolers 3 to 5 years old should get 10 to 13 hours per day. Children 6 to 13 years old should get 9 to 11 hours per night. Teenagers should get 14 to 17 should get 8 to 10 hours per night. Adults 18 to 64 or older should get 7 to 9 hours per night. So I have a baby, so my hours, I don't think it applies to me.
That doesn't count.
but I have a question for you, Dr. Todd.
Yes.
So if my child's in her room 8 hours a night, she's sleeping 8 hours then, right? That's good quality of sleep.
Well, that is where it gets tricky,
Okay.
right? Yes, because we have, a certain amount of sleep hours. And how many patients do we have sleep studies that shows they get the right hours of
Quite
sleep?
a few, yeah.
Quite a few. But then you look at that actual sleep quality.
That's different.
It shows a very different picture.
That's just what I wanted to point out. That so quantity of hours does not necessarily mean you're getting great quality of sleep. And I hear that a lot in my myofunctional therapy patients that, their kids are in the room 8 to 10 hours. They don't understand why, we have some other things going on. But I think one important note is that as a parent, you're not in there with your children checking on how they're sleeping, making sure that, you check for signs like, messy bed covers, hot sleepers, waking to go to the bathroom frequently, filming your little kids or young adult kids and just checking to make sure that, kind of what patterns do they have throughout their sleep cycles is really important. And I know that's something all of us at Breathe Airway share with our parents, is making sure that you're checking on your kids and seeing the quality of sleep, not just the quantity of hours.
Yeah, I would say if any parent is concerned about their children's quality of sleep, one thing I recommend is waiting until about 30 minutes to an hour after they've actually fallen asleep to then go in there and maybe with your cell phone, just capture footage of them and just see. And I think a lot of parents would be surprised by maybe the positions that their child sleeps in, what their mouth is doing, tossing and turning, drooling on the pillow, blankets, sheets getting, everywhere. I've had parents seem really surprised once we really start getting into those kinds of details of their children's sleep, because 100%, it's way more than just the time. We want to make sure that we kind of paint the picture for the parents of what does a sleep issue look like with younger kids, because it does tend to look different in younger kids
And it
than
can
it does in
be
adults.
very subtle.
Yes.
So mouth breathing doesn't always mean, right? Like
Very
you see
rarely,
with someone on a plane or less, right? So with kids, we're looking at very early warning signs. Okay, mouth breathing can just be slightly open and the tongue is down. With infants, that is normal sometimes to have their mouth open, but their tongue should be up. So a little bit different with infants. As long as the tongue is up and on the palate, roof of the mouth, okay, we're okay. With kids, if you even have a little bit of an opening, the tongue is mostly down. And just that disturbance in the airflow and that change versus coming from the nose is enough to set our body in a different mode that's going to cause a sleep disturbance. It's the turbulence of the air that comes through, and it's that change, right? Because we are supposed to be breathing here. It is meant to be coming from here. It's coming from here. And that's just like an alternate path that's just not quite right. And so that little bit is what sets off a whole sequela of different things that could go wrong.
And so that tossing and turning at night, those kinds of things, that movement at night is actually the kid's body responding to that impaired airflow.
Yes.
Right, and the lack of vagus nerve stimulation when the tongue sits in the palate. So when the tongue sits up, it puts us in rest and digest. When the tongue sits low, it puts us in fight or flight. And that is where children are striving. And actually, I say children because adults, I feel, have almost turned off that alarm. At least a lot of adults, right?
Yeah.
They don't even recognize they're tossing
You
and
get
turning.
numb to it over time.
Yep.
But in kiddos, they're very aware of it, and they're striving. Their brain wants that reset at night, and so they're trying to find it. And that tossing and turning motion is what helps create it. Or sometimes we see them sucking on their blanket or shirts or fingers or objects. Once again, they're trying to find that rest and digest, that state of rest, really.
Yeah, that vagal nerve stimulation. We also see bedwetting. Bedwetting can be issues with children who aren't getting the normal, adequate stages of deep sleep.
Yeah. It can be very common.
And it's not talked about because it can be embarrassing as well, I think, for kiddos and even for, adults who get up and frequently urinate. They don't really always want to share those things. We understand that.
Right. And when it's not something we, when we start in our airway conversations and consults, when I've had this discussion with patients in a dental setting, I can't tell you how many times parents have been like, yes, they do that. And what do you mean it has to do with their sleep? It's all just part of when the body gets placed in that, you say, fight or flight, sympathetic, versus the rest. Our body has a cascade of different things that go on, and bedwetting can be one of them. But it's interesting because it's not with every patient. Everyone's really unique in how they respond and compensate to having an airway issue. So that's why it can be complex, right? And that's why people don't just come in and say, well, I have poor quality sleep. It's all those other little things that lead us to, no, you do have poor quality of sleep.
Well, and I have a lot of adults who almost seem ashamed that they snore, and they don't want to admit to snoring. And I just want to let everyone know, do not be embarrassed that you snore. Most people do it. I have patients who have difficulty answering the question on one of our screening tools, do you snore loudly? And loudly meaning through like a closed door. And I'll have a lot of patients kind of write in a little explanation. Well, I kind of snore slightly, but not enough to be heard through a closed door. And I can tell they're just really embarrassed about it. Or, they'll mark no, but then, I'm kind of talking to them and their spouse is like, what are you talking about? You definitely snore. So I don't want any, to make anyone feel bad about snoring, but at the same time, it's not normal.
Yeah, and
be
it is kind of
snoring.
something you make fun of on like TV shows,
Yeah.
and that's like a silly, funny thing when we should be like, oh
Oh,
my
no.
gosh,
Yeah.
go to the doctor. Go, you should go get some help with that, right?
With
we just
love,
think
though.
it's funny.
Yeah.
So I know there's a couple of shows that Dr. Zaghi always shows in his courses. One is on Friends and The Simpsons, and they're kind of funny to laugh at, but from a medical standpoint, that's just an alarm going off in our head that there's a bigger problem going on. And this can lead to some severe health consequences. So I think if you question maybe you snore, there's some good free apps out there. Snore Lab is one of them. You can download it on your phone. Obviously doesn't have perfect accuracy, but I've heard it's pretty good. It's not a medical type sleep study, but it's hard to know if you snore sometimes because you're asleep. So unless you have a partner or someone telling you that you snore. So you can download Snore Lab and put it on at night and just see what it records.
But we're not paid by Snore Lab.
No.
But we should.
No. Yeah. So I think those are some really good topics that people can be aware of that really can lead back to looking at your own quality of sleep every night. How much caffeine do you need during the day to get through the day? We shouldn't have to be doing that. Caffeine stays in your system for a really, really long time and can disrupt your next day. But sometimes we get on this merry-go-round to survive our day and work and kids, and it's hard to jump off of that and figure out, okay, how do I just actually get a good night's sleep? So I'd encourage everyone to look at your own sleep habits and how do you feel like you're actually sleeping, and then you could have a further evaluation to decide, okay, well, why do I sleep this way?
Yeah,
Is it
I
my
think
tongue?
the very simple things you can do to try and improve your sleep, just like you said, at the very least, try to cut out caffeine, or at a minimum, keep it at least before 11 or noon at the latest. And then just really strive for that 7 to 9 hours of sleep. That just starts you off on the right foot there. But then also get an airway evaluation.
Yeah.
And I'll throw my tidbit because I like the tongue, obviously. Try to close your lips. Put your tongue up. If you can't, get an airway evaluation immediately.
Yeah, absolutely. Well, I think that's good for today, guys. So we'll see you next time.